and hopefully you've had your coffee this morning because we're going to have a great conversation. Very excited to join you as the moderator for this webinar today, where we're going to talk about all the things that you want to know about the new vaccines that are out there. My name is Zeta Smith, and I am the CEO of Sodexo Seniors for North America. And I would like to introduce you to my two panelists today. We'll first start with Dr. Mark Rupp. He is a professor and chief of the Division of Infectious Diseases in the Department of Internal Medicine at the University of Nebraska Medical Center. He is the medical director of the Nebraska Medical Center Department of Infection Control and Epidemiology. Dr. Rupp, if you wouldn't mind just introducing yourself and maybe some additional experience that you've had, as well as any experience you want to talk about with your being on the front line of the pandemic.
Zeta, thanks so much. It's just a real pleasure to join the group this morning. I'm certainly honored and very happy to do so. And I'm hoping that we'll, as you related, enjoy a lively conversation and hopefully be able to transmit some accurate information to everybody who's involved this morning and try to dispel some of the myths and maybe allay a little bit of the fear and anxiety associated with the COVID vaccine. Obviously the vaccine is just an amazing introduction of a new modality that we can use to combat this pandemic that has affected all of us. And quite frankly, this is the way that we're going to dig our way out of this pandemic and get back to some degree of normalcy that we all really crave. This is how we're going to be able to get back to seeing our family and friends without fear or anxiety, not having to wear a mask, to enjoy those things this summer that I think all of us want to do. Here at the Nebraska Medical Center, I've been on the front lines of combating the pandemic, steering the Infection Control Department and the Infectious Diseases Division. And unfortunately, this has been incredibly impactful on our medical center and on our community. And I think all of us want to do everything we can to get this in the rearview mirror. Thank you.
Thank you, Dr. Rupp, and appreciate all the work that you are doing out there. I know it's been quite a challenging year for you both personally and professionally, I'm sure. So thank you for joining this morning. Let me now turn it over to Dr. David Lindner, who is the current medical director of the COVID-19 Response for NCH. He also is the medical director of the ICUs and respiratory care, as well as teaching responsibilities for the internal medicine program with the Mayo Clinic. Dr. Lindner, can you share a little bit about your experience in the COVID-19 space?
I also wish to thank you, and I'm honored to participate in this program. Truly, I agree with Dr. Rupp that this has been an unprecedented event for all of us, that I think all of us have this emotion of wanting to get behind us. And I have obviously come to this not from the infectious disease background, but from the pulmonary and ICU, and have led the group in both research with my colleagues at Mayo on a number of the treatments. And I think that I would echo his comments that we have spent a tremendous amount of time in the last year working extraordinarily hard to treat people with COVID-19. The unfortunate part with that is that we know that there is a group of people who will not do well. And we've been coming at this only after the fact of COVID-19. And now we have the ability and with extraordinary efficaciousness, which means it works, to actually do the opposite, to prevent people from getting COVID-19. The vaccines are remarkably disease preventing. And we hope that what we can convey to everyone is that, in all honesty, I don't want to see you. I want to actually keep you out of the whirlwind of COVID treatment, and hopefully by answering some of people's questions, correcting misperceptions about the vaccine and our research on it, that we can do so.
Thank you, Dr. Lindner. And It's great to see you, but you're right. I probably don't want to see you where you work. And that's why we're here today. This is really about getting an understanding of these vaccines, getting the facts. There's certainly a lot of myths out there on social media and from family and friends. And this is a platform for all of you just to ask the questions that you want to get answered so that you can make the decision to get vaccinated. So we're going to get started. Again, this is, a back and forth asking Dr. Rupp and Dr. Lindner questions that are coming in through the chat, and they will do their best to answer them as they come in. So are we ready, gentlemen?
Let's go.
Okay, I see thumbs up. So Dr. Rupp, I'll start with you with the very basic question just to open up the webinar, which is, why should I get a vaccine?
Well, it just makes an awful lot of sense to get vaccinated against this disease. If you do it only from the standpoint of self-preservation, that's reason enough. Obviously, this can be a severe disease, particularly in people who have risk factors such as being a little bit older in age, obesity, underlying hypertension, cardiovascular disease, diabetes, et cetera. So if you fit it into one of those age groups, it makes great sense to just try to save your life. In addition, there's a lot of people who I think have this perception that because they're young and healthy, that they don't really have to worry about this disease. And in many instances, it will be a mild disease and they won't necessarily be hospitalized or lose their lives from the illness. But unfortunately, we're seeing an increasing number of people that have these lingering symptoms due to COVID-19. Even young, healthy people with mild disease then go on sometimes to explain months of illness where they just feel fatigued and malaise, and they have this thing that they call brain fog, where they just have cognitive problems and can't think straight. Low-grade fevers, the aches and pains. And in many instances, this keeps them from going back to the classroom or sometimes going back into the workplace for months. And most folks just can't afford that kind of a time off. So if it's only from the sense of self-preservation, it's a great idea to get the vaccination. But in addition to that, it will prevent you from transmitting the illness to somebody else. So it's possible that you would have a mild, relatively asymptomatic case. You could take that home, transmit it to your parents, to your grandma and grandpa, to other people that you really care about and love. And then you would feel incredibly guilty, having transmitted that to somebody who could lose their life or have a very severe disease or long-lasting manifestations. And then lastly, it's just the right thing to do. As a community, we all need to pull together, take care of one another, and to get this pandemic squashed down just as low as we possibly can so that we can keep it under control, keep it a manageable disease, and then go forward, hopefully later this summer, with a much more normal existence throughout our society. So those are the reasons to get the vaccine. Help yourself, help your family, help your community.
Thank you, Dr. Rupp. And I think when the vaccines first came out, I think most people thought, okay, well, this may help prevent me from getting sick. I think the biggest piece, is it can not transmit to someone else. So now you're keeping other people safe. So this is much bigger than one individual. So thank you for sharing your thoughts on that. So Dr. Lindner, is the vaccine safe? Obviously, there's a lot of myths out there of how fast it was made and, is it stable? So is it safe, and what side effects can we expect?
Well, we've seen with all of the news and media that there was an unprecedented effort to develop the vaccine with that. Now, remember, we have two basic types of the vaccine right now. Everyone's heard of the messenger RNA vaccine, and then we now have other vaccines that have come onto the market, and with the Johnson & Johnson being a much more traditional vaccine in the all manners of its production and development. Many of the questions about safety have related to the fact that the messenger RNA vaccines are, quote, new. In all honesty, we've been working with messenger RNA now for multiple years, going back into 2010. And the efficaciousness of these, the benefit, the safety of these is being shown. These have been studied, vigorously studied. We now are having data not into just the hundreds or thousands, but actually we've had reported data into the millions. And basically we're seeing similar types of reactions that we've seen with most vaccines. Remember, your body is going to respond. The vaccine is telling your body to do something. It's telling your body to make antibodies to COVID. And traditionally, with all vaccines, I'm sure many of the people in this webinar have maybe had, like, for instance, the shingles shot. Most people who get the shingles vaccine, I mean, we get up to 50% of the people having some type of reaction to that. But yet people's fear of getting shingles continues to do so, and they're willing to put up with a day or so of the reaction. So these vaccines are being shown to be safe. There are small groups of people who have certain types of medical problems who need the advice of their physician as to whether or not they should have the vaccine, or should they time it, particularly with certain types of therapy that they might be on. And I would encourage people to, if they have any question about their medical condition or drugs that they're on, that they speak with their provider, because then they can get additional information. But overall, these vaccines right now have been proven in the administration that we have had to not only be safe, but work. We now have, for the first time, up to 6-month data that these vaccines are actually proving to exceed our expectations in how they are working.
So Dr. Lindner, one of the questions that just came in is, why do some people have symptoms after the shot and others don't?
Well, the simple answer to that, and Dr. Rupp may expound on this further, is that, of course, all of us are different. We all have different immune systems. We all have different reactions with that. We do see that sometimes some of our more elderly patients, at least in my experience so far, and been involved with vaccination of probably now 25 to 30,000 people within that we have provided here in West Florida. And we're seeing somewhat sometimes a lower reaction rate among some of our older individuals. And I think that when we see that, there appears to be a difference in basically how people's immune system reacts to that. Mm-hmm. Personally, I had chills. I had felt like I was going to get a fever. I felt the aches and malaise with that. My wife, who was also vaccinated, had the 7th to 8th day after the Moderna got the big red splotch on her arm, which some are now referring to as Moderna arm. And with that, these are all different. And unfortunately, the best answer I can give is that that's because all of us are different, and we're going to see variations on those themes of response to the vaccine.
Yes, and each individual, to your point, has different reactions. But I shared on the webinar last week that some of the effects are just the immune system talking to us. We want it to work. And so each individual will have varying symptoms, but thank you for that answer. Dr. Rupp, Dr. Lindner kind of spoke to the effectiveness of vaccines, but I'd like to hear your perspective on, is the vaccine effective?
Yeah, absolutely. These vaccines are amazingly effective. I think people can think back just a few months ago when the folks were talking about the vaccine, and if it came out and it was 50 or 60% effective, we would be happy with that. Well, this has been a real home run, and these vaccines, the mRNA vaccines, are 90 to 95% effective in preventing clinical illness, and they're almost 100% effective in preventing people from developing severe disease, going into the hospital, and dying from the infection. Those are the mRNA vaccines. The J&J vaccine may be just a little bit less effective, but the studies weren't done head to head. So they weren't comparing Johnson & Johnson with Pfizer or Moderna. So it's really hard to make that statement. And they were also done during a different time period when the level of infection was at a higher point when the J&J vaccine was being studied. So the bottom line is that really all the vaccines work really very, very well. The vaccine that people should get is the one that's available to them, quite frankly. So I wouldn't sit back on the sidelines waiting for the J&J vaccine because it's just one shot versus Pfizer or Moderna that take 2 shots. Get the vaccine that's available to you. At the end of the day, it keeps you out of the hospital, it keeps you out of the graveyard. And those are the 2 things that we really want to see. There's also increasing amounts of data, as Dr. Lindner related, that the longevity of the protection, the longer we look, the better it looks. And so we have data going out 6 months or more now, looking at this and showing that it's quite effective. In addition, one of the questions was, will it prevent asymptomatic disease and shedding of the virus? And the more data we get, it looks like it also prevents that. So prevents clinical illness as well as asymptomatic illness. It is a good deal for folks, quite frankly.
Thank you, Dr. Rupp. Dr. Lindner, are there any long-term side effects from the vaccine that we need to be aware of?
In looking at what we've had, again, the data and published, to date, we're not really seeing long-term side effects. People need to understand that basically those of us who are involved in vaccination, that there is a reporting system of side effects, and that these side effects, obviously people now are realizing, I referred to the big red splotch on the arm with Moderna. And at first, numerous individuals were reporting this. As it became clear that this is one of the things, then that reporting then started going down because people realized, hey, I've seen that one before. So what we're seeing, again, in addition to the amazing effectiveness of these vaccines, is that we're seeing traditionally about the same level that we see with other vaccines, which is down in about a single-digit range, 1-2% of people who are having any side effects. And we're not seeing to date long-term side effects of these vaccines. With that. Now, the important thing with a number of the vaccines that people are always concerned about, does the vaccine impact my DNA? No, it does not. Does the vaccine have preservatives? Numerous of the mRNA vaccines, they have no preservatives in them. So a number of these things that have been, I'm to say, basically shared out on some of the social media sites, quite frankly, just don't have any rational part in when you look at the actual data or actually manner in which the vaccines have been developed.
Yes, and that is exactly why we're having this webinar today, because of the stories, the myths that are out there and wanting to get those facts. So thank you for sharing that, Dr. Lindner. Dr. Rupp, one of the questions that came in is, I'm hearing a lot about the new variants. Do they make you sicker?
Yeah, Zeta, this is a great question, and it's one that a lot of people have a great deal of concern about. The fact that the virus has mutations and changes its characteristics a little bit is completely known, and it's not at all unexpected that over time the virus will shift a little bit. We've seen some variants emerging from various countries, and I'm sure a lot of the viewers have seen the reports from the UK variant or the Brazil variant or the South African variant. We also have these evolving here in the United States, and there's a New York and a California variant that have been described. For the most part, these variants have mutations in a crucial element of the virus called the spike protein, and it's the spike protein that enables it to interact with human cells. So when the spike protein goes under mutational events, it either binds more avidly, more easily to human cells. And it's thought that this might be the explanation for why most of these variants appear to be more transmissible. So the data is very clear that these variants can be transmitted more easily from one person to another. And so we have great concern about that. So that's why we think we're seeing the cases currently going up across the country into what some people are expecting a fourth wave of the pandemic at this point. There's also some information to suggest that some of these variants can be more severe. And so the rate of hospitalization or mortality has been shown to be somewhat more high in at least some of the studies looking at this. And then there's a glimmer that some of the variants are less responsive to some of the medications that we've developed to fight COVID-19, the monoclonal antibodies. Mm-hmm. And there's a little bit of information to suggest that in some cases, the vaccine is just a little bit less effective. Now, I want to be really quick to point out that the level of protection that we're getting from the vaccination appears to be quite protective against the variants, but it's just a little bit less effective. So we think that it will still be effective in preventing illness and deaths and hospitalization, but the degree of what we call neutralizing antibody is just a little bit less effective against some of these variants than the wild type strains. This is another great reason why people need to get the vaccine as soon as it is available to them, because it does protect against these variants that we're starting to see spread across the United States and around the world. So a great question. And again, just another reason to try to go as quickly as possible and get the vaccination.
Thank you, Dr. Rupp. And it's interesting because with all of the news channels talking about the variant and the easy spread, what you hear is the race to get the vaccines as fast as possible to try to prevent those variants. So, and it sounds like based off of what you're sharing, the vaccine is still effective. It may not be as effective, but it is still effective. Is that correct?
That's correct, Zeta. The vaccine, we think, will prevent all of these variants from causing serious illness. And as you related, it's kind of a race between the variants and the vaccine. And it's also a reason until you get vaccinated, and even afterwards, we need to all be very careful with regard to the non-pharmacologic intervention. So continuing to wear a mask, continuing to do that physical distancing, avoid putting yourself in those high-risk conditions, such as a crowded restaurant or a bar or some other indoor shared airspace where these variants can really start to take off. So we all need to do our part. Number one, get vaccinated. Number two, continue the non-pharmacologic interventions until we can get to that herd immunity and get this pandemic squashed down.
Okay, thank you.
Ms. Smith, if I may, and add one thing. If you look at, and let's specifically look at the B117 variant, which is the United Kingdom variant. You saw across Europe, you see the amount of cases coming down, and then this variant, which was much more, as Dr. Rupp said, infectious, and then you saw the number of cases go up. So let's move to Israel, which basically had an aggressive rollout of their vaccination program using the Pfizer vaccine. And that variant was present. And what you saw is throughout most of Europe, you've seen another rise, another wave, as you repeated. And yet what you saw in this one place where an aggressive vaccination program throughout all facets of their communities. And what did you not see? You haven't seen the rise in the wave of this of that highly infectious variant. We have good data that the vaccines are appropriate for shutting down even the variants. COVID is going to keep, as he put it, shifting and trying to maintain, think like a virus. It wants to survive. And it wants to, make many more viruses because that's what the virus does. But the vaccines are being effective at shutting down the variants. And we've got good information on that. I don't know, it seemed like a real life example of where we have used the vaccine to shut a variant down. And so I thought I would add that on to the excellent comments that he put in.
No, very, very helpful. While I have you, Dr. Lindner, is it safe for me to get a vaccine if I have an underlying medical condition?
Yes, for the most part. In fact, I would rephrase that statement somewhat differently. Okay, with that, my concern would be people with underlying medical conditions not getting the vaccine. This is the group of people who are at the greatest risk for basically ending up in the hospital, ending up with either dying or the people who now we are struggling with trying to understand what to do with people who are referred to as long haulers and people who are having side effects and complications of COVID. So I would phrase it oppositely, that this is a group of people I desperately want to have the vaccine to be administered to. Outside of those people who are post-transplant, and some questions about timing of medications, particularly if you're on immunosuppressive medications for certain diseases, which you need to coordinate with your provider. People who have diabetes and hypertension, people who have other medical conditions really need to be the ones that are first in line, at least in their desire to get the vaccine.
Thank you. Thank you. Dr. Rupp, switching gears a little bit, one of the questions that came in, if I've already had COVID-19 and recovered, will a vaccine still be beneficial to me? Will I have immunity?
Yeah, Zeta, another great question. And yes, the vaccine is recommended for people who've had COVID-19. Part of the reason for that is that the immunologic response to the natural viral infection can be kind of spotty. And some people have a very robust response and other people don't have quite as vigorous a response, and it tends to tail off fairly quickly. We actually think that the vaccine will work better than Mother Nature and will give people a longer lasting immunologic memory for this and prevent infection down the road. So the simple answer to your question is yes, they should go ahead and get vaccinated. Some folks are recommending that if they want to hold off for a little while and wait maybe 2 or 3 months till they get the vaccine, that would be reasonable because the level of immunity that they have acquired from their initial infection typically will protect them for at least a couple, 3 months. And then at that point, we are starting to see people get reinfected. So that might be a signal that they really do need to get the vaccine at that point. But the official recommendation is that once you have recovered from COVID-19 and you're over the clinical illness, it's okay to go ahead and get the vaccine. So again, I just don't want people to miss out on their opportunity because logistically, they don't know where they're going to be in 2 or 3 months. If you have the vaccine and it's available to you, I would go ahead and take it.
Can I ask, because the question just came in, is it possible to be infected and be asymptomatic after having been vaccinated?
It's possible, but what we're seeing is that that's very unlikely, that the vaccine not only protects against people having clinical illness, it also appears to be very effective in preventing people from having asymptomatic disease. Now, keep in mind that this vaccine and no vaccine is 100% effective. So people clearly can get vaccinated and then go on to get clinical or asymptomatic illness, but it's just very rare. It's much less likely, but it does occur.
Thank you. Dr. Lindner, do I need to wear a mask and avoid close contact with others after I receive both doses of the vaccine?
That's going to be an excellent question, and I'm going to be honest and say that's probably right now a moving target with that. We're still recommending, and Dr. Rupp just referred to the fact that we have a small group of people who the vaccine will fail on. The initial fears were that as we realized that the vaccines were definitely disease preventing, would we still have a group of people who might get the infection and then walk around spreading the infection to those who were not vaccinated? And again, the data that we continue to get is showing that that is not being the case. And I think we're going to see progressive relaxation ultimately of the masking. We have already seen it recommended that in groups where people are vaccinated, that those people can get together in small groups. And if that both myself and others have been vaccinated, not wear a mask. I think ultimately we're going to get there. But at the moment, with that, we're still, because we have a number of individuals who are not vaccinated. We haven't really penetrated to the level we need to. We need to still practice non-vaccine levels of protection, which predominantly is masking in inappropriate situations, continuing to keep our distance. But I think we're going to see those basically presently necessary measures start to be relaxed among those who've been vaccinated. The real problem is that then that depends for people who have been not vaccinated, that they're still willing to practice those measures. And that's get difficult, where we then start, are we gonna have to show and prove that I've been vaccinated and you not? And so at the moment, in basically the desire to protect my fellow, workers, family, and all, we're still trying to keep people to do the right thing and protect each other with the masks. So that's an excellent question, and it's going to be one that is changing, not because basically the recommendations are changing, but just because the level of immunity and vaccination is going to be changing.
Yes, and I think with, as you spoke about the updated CDC guidelines that will continue to change and be updated, I think it is about loosening some of the restrictions, but to your point, those that have not been vaccinated yet, it doesn't mean they can loosen the restrictions. And I think that's where we're seeing some of those behavioral challenges out there today.
Mm-hmm.
One of the, I should say, several questions coming in, and would like both of you to weigh in on this, but there is a lot of concern being expressed about how quickly the vaccines have been created. And one of the examples I'll share is were any of the mRNA vaccine tested on humans other than on clinical trials? And has there been data that is 2 years or longer? So I think it speaks to kind of this, hey, this happened so quickly. So Dr. Lindner, you spoke earlier about, hey, we've been working with this since 2010 as an example. Maybe I'll start with you, and then Dr. Rupp, if you could add on.
Well, messenger RNA technology has been around for a while. We have been dealing with this and working with this in both laboratory, obviously, and to specifically answer your question, human basically use of this technology. The real key to the technology was this fat lipid covering of the vaccine, which people may have seen in the news referred to as PEG, which was essentially developed to help get the messenger RNA into the body. The traditional vaccine, for instance, the J&J vaccine, uses an adenovirus that basically conveys the spike protein into the cells. So all vaccines have to get the information into your body that then basically, and what messenger RNA does is that RNA essentially just tells your body to make something. That's in some regards, you can think of it as that's what messenger does. We have utilized it, and it has been developed. There is a Zika vaccine that is messenger RNA. What happened though is we controlled Zika predominantly through public health care means. All right. There have been other entities developed, and in my personal opinion, and with a couple relationships with some people who I know are involved in research, I think one of the potential silver linings of the whole COVID is going to be the continued development of messenger RNA. because what we can do is I can now tell our body to do something. And the potential for that in future treatments is going to be really, in some ways, it may be one of the things that people are going to look back on and go, wow, that's what COVID brought to us. So this is not new. This has been going on for a while and has been now tested in numerous settings, mechanisms, manners, and yes, with people. And we are really learning how to utilize messenger RNA. And I think that that's going to be something that is going to benefit all of us in the future.
Dr. Rupp, you want to
Yes.
add?
Yeah, I would, Zeta. Thank you. So I think that, we need to acknowledge people's hesitancy and their fear in this regard. And they're absolutely correct that these vaccines were developed and brought forward at an unprecedented pace. But I guess what I would emphasize is that doesn't mean that they really cut corners with the safety evaluation for these vaccines. So they were very carefully studied in tens of thousands of patients in very, very well-designed, blinded, placebo-controlled prospective trials. And those trials are ongoing. As we've related, we continue to watch those people as time goes on. And the vaccine has been shown to be very, very effective and very, very safe. Now, we have to acknowledge to people that, no, we don't have experience with this vaccine out 2, 3, 4, 5 years like we would with some other vaccines. And that's why they have an emergency use authorization. We're in the middle of a pandemic, and we need to bring these vaccines forward in order to gain control over this pandemic. And so, I understand why people would ask that question and say, you don't have experience with this out 3, 4, 5 years. And that's absolutely true. We don't. But we continue to accrue data. Everything that we've seen to date suggests that the vaccines are safe. We know that they're quite effective. We don't know how long that effectiveness will last. And will people need a booster dose in 1 years or 2 years or, somewhere down the road? But again, I would reassure folks that everything that we've seen with this vaccine, in addition with the knowledge that we have with previous vaccines, that, if we haven't seen a serious signal for some sort of a toxicity or side effect at this point, it's very unlikely that we're going to see something further down the road. So I feel very confident in saying to people that this is safe and it's effective. We just don't know how long it will be effective. And that's the big question is, are we going to need booster doses down the road? We just don't know that at this point.
Thank you, Dr. Rupp. So while I have you, just kind of switching gears a little bit, and we spoke about this, I think, last week when we were talking about just a lot of the myths that are out there. And one prominent one seems to be certainly in women within their reproductive years and the impact or the effect that a vaccine may have. Can you elaborate on that?
Yeah, there are a lot of myths and misinformation that are out there. And in many instances, they have a small kernel of truth to them. And so the way that this myth got started with regard to the COVID vaccines is that the spike protein has a very, very small area of similarity to a protein that is found in the human placenta. And so people, then made this leap that somehow if you get vaccinated, you're going to form antibodies that will attack the placenta. And that's just not true. The level of homology or similarity is extremely limited. There's no data to suggest that people form antibodies against the placenta due to vaccination. And even if they did, you would form the same antibodies with natural infection. So you get exposed to the spike protein when you have the natural infection. So you're going to have the same risk of becoming sterile from a natural infection or from the vaccine. And neither of those are true. So it kind of takes on this myth and it just gets spread through social media, and it's very unfortunate. There were people who actually got vaccinated and did get pregnant during the trials. So we know that those folks were able to get pregnant, even though, they were supposed to be practicing precautions. And so, again, all the information suggests that this is just a myth and that people should not be concerned about human sterility in relationship to the vaccine or, for that matter, from natural infection.
So Dr. Rupp, you spoke briefly about pregnant women. So there was a question that was asked, it wasn't tested on pregnant women or women who were breastfeeding, so should I just wait?
So that's a great question, and they're absolutely correct that pregnant women were excluded from these studies. Those studies are now being done. In addition, we have more information on breastfeeding women, and it does appear perfectly safe in that group of folks. All of the professional societies that represent women and pregnant women are suggesting that the vaccine be available to a pregnant woman. Now, again, because they've not been tested in large studies, the recommendation is not strongly in favor of getting vaccine, but it is that the vaccine should be available to a pregnant woman. They shouldn't be excluded from getting the vaccine. There are many vaccines that are absolutely indicated in pregnancy. So I think that that's a misnomer that people have, that if you're pregnant, you shouldn't get a vaccine. There are vaccines like the influenza vaccine, for instance, in which you really should get vaccinated during pregnancy. And the same thing I think is true with COVID-19, but we just don't know that at this point. All the indicators are that this vaccine should not be dangerous or have an adverse effect with women. Again, the women who became pregnant while they had been in the vaccine trials, those women are being watched very carefully, but there's no signal that they're having increased numbers of miscarriages or any other kind of pregnancy-related problem. So again, my thought is that the vaccine is probably safe. We don't know that absolutely for sure. Those studies are being done. In the meantime, talk to your provider, talk to your obstetrician, and most of them that I know are saying that yes, women should go ahead and get vaccinated, because we know that if you get COVID while you're pregnant, that it can be a very severe illness, and you're at a greater increased risk of having severe disease and fetal loss and problems.
Thank you, Dr. Rupp. Dr. Lindner, one of the questions that came in, I'm worried about an allergic reaction to the vaccine. What reactions might occur?
The data and the signal of the number of severe allergic reactions that we've seen have been very small. You realize that when you get the vaccine, with that, you are monitored, and most of the reactions that we see that could have concern occur within this first period of time immediately following the vaccine. And so once you have the vaccine, you're going to be asked to, basically be monitored for that period of time. Obviously, the reactions that we truly worry about, the ones that are more of what you may hear referred to as more of an anaphylactic type or anaphylactoid type reaction. And these are the ones where people would have blood pressure issues or breathing issues. And both in traditional vaccination efforts that we do, as well as those type of reactions are much more immediate. Many of the reactions that everyone is hearing about, the fever, the aches, the arm redness, are ones that occur later and are of much less concern. So the people need to realize that they are going to be monitored for severe type of reactions in the immediate period following the vaccine. And once that period is over, those type of reactions are exceptionally rare to occur in a much later period of time.
Thank you, Dr. Lindner.
Zeta, can I jump in? Zeta, can I jump in on that? Because yes. I just wanted to elaborate on something that Dr. Lindner said earlier, that the little lipid nanoparticle is made up of partially of this polyethylene glycol, and that people who've had allergic reactions to some over-the-counter laxatives is somewhat predictive of having a bad allergic reaction with the vaccine. So that's just something to throw out there for your viewers.
Yeah, that is true.
That would be one of the things that would be a contraindication to vaccination.
Also, I know there was a question about, okay, if I have an egg allergy, have eggs been used at all in the vaccine?
No.
Okay.
I mean, that has been propagated predominantly because of the influenza vaccines have a egg lecithin component to that. And these vaccines do not have that egg lecithin component to them. And so egg allergy is not a contraindication to the COVID vaccine.
Okay, thank you. Dr. Rupp, what is the difference? There's a couple of different vaccines that are out there from Pfizer, Moderna, Johnson & Johnson, AstraZeneca that is still being tested here. What are the differences that you could share?
Well, there are several different types of vaccines that are available, and this is actually a tremendous advantage to us. As people know, with Project Warp Speed, the government, along with a unified purpose with industry and medical science, essentially bet on a bunch of different horses, hoping that at least one or two of them would cross the finish line. And as it turns out, we're seeing multiple horses cross the finish line. So the first two were the mRNA vaccines with Pfizer and Moderna. As Dr. Lindner has already explained, these are vaccines that are using kind of a novel approach in which mRNA is delivered to people's cells in these little lipid nanoparticles. The body reads that mRNA, which is just the instructions for producing a protein, the spike protein. And then your immunologic system sees the spike protein and responds to it and develops long-lasting immunity. Another type of vaccine that are now out are these adenovirus vectored vaccines. So they're using an adenovirus, which is just a virus that causes a common cold. Furthermore, that common cold virus is engineered so it can't replicate. So you can't get an infection from the adenovirus, but the adenovirus is used as a delivery vehicle to deliver, again, the DNA or a different kind of message to your body so that it produces spike protein. And then you develop an immunologic response to that and long-lasting memory and immunity from COVID-19. And then there's a third type of vaccine that's just knocking on the door, and that's a very much more traditional adjuvanted protein vaccine. So Novavax is in the final stages of its studies. We're hopeful that we're going to have all three of these types of vaccines to be able to deliver to people. And again, this is a tremendous advantage because as we go forward, we may figure out that one type of vaccine works better in an old person or in a child, or may have a longer lasting immunologic effect, and therefore you don't need a booster. So these are the questions that we'll be looking forward to as time goes on. But it's terrific that we have all these different choices. The mRNA vaccines are 2 doses. The J&J vaccine is 1 dose. That's one of the major differences. J&J can be stored at normal refrigerator temperatures, whereas the mRNA vaccines are fairly fragile and have to be kept under very controlled freezer temperatures. So those are just a few of the differences with the vaccines. And again, it's a real triumph of medical science, and it just shows what can be done when government, industry, medical science, the population all come together with a unified purpose. And that's really what was illustrated. So again, safety corners really weren't cut, but they did cut the red tape.
I think it's important to realize, and he just said this, but I'll just rephrase one thing. There's no real winner yet. I mean, I think some people have been, I've had numerous individuals tell me, well, I'm waiting to find out which one's going to be best. And there's not really a winner right now. I think the winner for each person has been referred to. It's the vaccine that is available for you. Our real problem has been over this initial period of time, especially at least I had in our area, and I'm sure in other areas as well, was there was this pent-up demand and people were frustrated because they couldn't get access to it. The supply chain is now catching up to the demand, and now we're doing things like this where we're really trying to address people who have not been vaccinated yet and their concerns regarding the vaccine. And so that's going to be the switch. Soon, it's probable that, at least in our country, we're going to be swimming in vaccine. I mean, we're going to be having the ability that those people who want it can get it. And only once we have that, may we find that certain groups of people should be getting a certain vaccine. But at the moment, there is no real winner.
Thank you, Dr. Lindner. Dr. Rupp, one of the questions that came in was around kids currently are not getting vaccinated, but we know that I believe it's Pfizer that has begun doing some testing, maybe others as well. If I'm a grandparent, I've been vaccinated and I have grandchildren that I want to see, what are the recommendations on how we interact when they may not have been vaccinated yet?
Well, again, because the vaccine is so effective, if you're a grandparent and you've been fully vaccinated, so you've had 2 weeks past your last dose, whether it be the 2-dose regimen or a single dose J&J, you should feel pretty secure in visiting your grandchildren as long as they're healthy and asymptomatic and they've not had any high-risk exposures. I think that this has been just a wonderful thing for grandparents and for other people, that have really, unfortunately, not seen family members for a year or more. Our elderly in nursing homes, we're starting to be able to liberalize some of those visitation policies so that people who've been vaccinated can now start to interact much more safely with their loved ones. So the studies are being done in kids. As you mentioned, the Pfizer vaccine is licensed for those 16 and older. Last week, they came forward with data to suggest that kids 12 to 16 likewise appear to be safe and effective. Now the studies are being done all the way down to 6 months of age and older to figure out, where's the break point of where a child will respond to the vaccine and how well do they work. So I think the day is quickly coming when this is going to be an indicated safe and effective vaccine for kids. And that will help us also to get the pandemic under control, because we know that kids can spread the illness, even though they aren't as likely to develop severe disease. But having said that, we've certainly seen kids with severe disease or even have lost their lives due to this infection. So they're part of the equation and part of the way that we're going to get to the end of this pandemic.
Thank you. And I think certainly that is great news for grandparents to see their grandkids. It's been a very long year. I come from the seniors industry, and to see visitation, et cetera, kind of open up now because of the vaccines has certainly been encouraging news. Let me pass it on to Dr. Lindner. Shingles, flu vaccines, what is the recommendation here on the timing? So do you have to wait? Can you get them all within a certain period of time? What's the safety aspects there?
I missed you broke up on just one of the part.
So shingles or flu vaccines and the timing, can you get them in addition to the COVID vaccines within a period of time? What's the safety aspect of that?
Well, we were recommending that people did get the influenza vaccine. Obviously, at this point in time of the year, that season is pretty much rapidly coming to a close. Interestingly enough, I don't know what Dr. Rupp has experienced, but for the first time in my 26 years, I have not had a single influenza patient in the ICU for the first time in, at least on our data, since I have been here. So the fact is that for most people, I would not recommend that they have simultaneously get multiple vaccines. I've had a couple of my military people comment and remember when they had been vaccinated with numerous things, and it was a very rough period of time right thereafter. With that. So for the most part, the recommendation has been to spread the vaccines out at least greater than 2 weeks period of time. If there's going to be multiple vaccinations necessitated, for the most part, the influenza season has come to a close in most areas. I don't know many people who are still actively looking to vaccinate people for influenza. I'm sure that there are some areas with that. As to getting the shingles shot with that, I would not partner that with the COVID vaccine. I would wait and separate that out from a period of time, and that has been what most people have recommended for that.
Dr. Rupp, did you have anything to add?
Zeta, I'd be happy to. So I agree with Dr. Lindner that you want to wait at least 2 weeks after your COVID vaccines have been completed before you would get another vaccine. And frankly, from just a logistical standpoint, I would be hesitant to have anybody get a different vaccine in between the 2 COVID shots. Again, the timing is just too tight, and I'd much rather get people through their COVID vaccination series, because that's what we're seeing and that's what they're going to die from at this point, as opposed to waiting a little bit down the road and then get those other indicated vaccines. And then Zeta, I know we're getting into just the last minutes of the webinar. And, what I wanted to get across to the audience is that, I understand the hesitancy that some people are feeling with regard to the COVID-19 vaccine. You don't have to look very far to see examples of government and authority and medical science behaving poorly. And, the real tragedy that we're facing right now is that we can't let the experience and the fear that we have from those past experiences keep us from doing what we need to do and what's right now. And so, what I would reassure the audience is that, don't let the past mistakes have us make another mistake, which would be to not get the vaccine at this point. This is a vaccine that is very highly effective, as we've talked about today. It's very safe, albeit people will have, a minority of them will have side effects from the vaccine that may, actually keep them laid up for a day or two. But those symptoms pale into insignificance compared to the real risk of having severe disease, long-lasting disease, transmitting disease to others that we're seeing with the COVID-19. So in the strongest terms, I would reassure people and tell them that the vaccine is a good deal for them, for their families, and for their community.
Thank you, Dr. Rupp, and thank you for all that you're doing out there on the front lines of this pandemic. I know it's been certainly a very challenging year. Dr. Lindner, any last words before we wrap up the webinar today?
I think that Dr. Rupp just said what I would have wished I had the opportunity to say as well. I want to echo his words there. There are many things, and we have a very elderly population in South Florida, obviously, with that, and had the privilege to talk to some people who remember when, basically certain diseases, were addressed for the first time. And a lot of our people, our memory is short. They don't remember when parents had this, abject fear that polio was going to be affecting their children, or some of these other things. And all of a sudden, this world changed because we were able to prevent that. I don't know if some of the other individuals have ever had both the responsibility and privilege to work in areas of the world that don't have that, and watch people who basically are having diseases that we just don't see here. I've watched and treated and worked with a group that we're in trying to deal with tetanus, and for most of us, and there are numerous individuals have never seen a tetanus. And so I'm basically encouraging people to remember that, we have the same situation occurring now, where we have the opportunity to alter really presently the course of our history with vaccination. And, and truly the disease is definitely worse than the cure in this situation.
And as I just shared with Dr. Rupp, Dr. Lindner, thank you. Thank you for the work that you're doing. Thank you for sharing your passion and your insights, and certainly working the front lines of the pandemic and making a difference. I do want to thank all of you for joining us today. This was about getting the facts, getting educated on the vaccines that are out there, and having the experts kind of share their level of expertise and experience, having been on the front lines from the beginning. We will do this again tomorrow, Wednesday at 6 p.m. Eastern Standard Time. So if you have additional questions that didn't get answered today, please join us again tomorrow. There's also a link that I can share with you now about where you can get some more facts. So it's www.us.sodexo.com/get-the-facts. So once again, appreciate everyone's time today. And Dr. Rupp, Dr. Lindner, thank you so much for sharing your expertise. Everyone take care of yourselves. Be safe.